Good evening, everyone. It's Dr. Trevor Berry from Phoenix, Arizona, and I'm a board certified neurologist specialized in brain based rehabilitation here in the United States. And I just want to say thank you for allowing me to be part of this wonderful cause and this great evening. And I'm just going to spend a few minutes discussing some of the advanced technologies that we use in our brain rehabilitation that are, it's kind of considered, I guess, cutting edge technology, even though the research has been around for a few decades now. That being low level laser therapy and how it is arguably the most important tool that we use in our brain based practice. Low level laser therapy checks off a lot of boxes that are needed for brain rehabilitation, and this can be utilized in pediatric conditions such as anoxic brain conditions and such, all the way on up to neurodegenerative changes such as Alzheimer's and Parkinson's. The research is really robust, backing up this technology, and it's kind of one of those things where it's almost too good to be true when you hear about all of the accolades and research-based physiological changes. And I'll talk about the one caveat with low-level laser therapy a little bit later on. So when you look at the technology and the research and what we see clinically, one of the big bonuses with it is that it actually promotes not only new pathway formation, or what's called BDNF and synaptogenesis, or the term can be neuroplasticity, about making new connections, but there is also evidence that low-level laser to the brain can actually promote new neurogenesis. So your neuronal cells, your brain cells, don't undergo mitosis. So once you lose it, it's gone, but it's actually been shown to promote new neuronal pathway formation and new neuron pathway formation, which is really big when you look at brain rehabilitation in anoxic brain injuries. It also has been shown to downregulate brain inflammation. And again, when you've had a brain injury, one of the big long-term things, and not just in traumatic injuries or anoxic injuries, but with chemical injuries and things of that nature, pathogens that we're seeing in the brains, like long haulers and things of that nature, is that you need to be able to shut off brain inflammation, or what's called M1, M2 glial resolution. And low-level laser to the brain actually has been shown to be one of the most effective tools to do that. Lasers to the brain will help promote blood flow to the brain, neovascularization or new blood vessel formation. It will promote antioxidant systems, so all your free radical scavengers like glutathione and superoxide dismutase and whatnot are promoted with low-level laser therapy. It has been shown to repair and protect your blood-brain barrier, which is absolutely critical, especially in brain injuries, as well as the gut barrier. We actually use our low-level laser therapies for vagal nerve stimulation, which is really big in brain rehabilitation. So that's another added bonus. When you use red lasers, it actually promotes parasympathetic, high-frequency autonomic regulation, kind of that resting, digesting part of your nervous system. So we'll use it with autonomic stuff, blood flow, blood pressure alteration, barrier systems, and things of that nature. It has been shown to actually in dormant, say, stroke situations, and we can actually open up and reestablish pathway activity that has been dormant for not just days, but months and even years and decades. I've had cases come in that had been discharged from maximum medical improvement. It's been over 10 years, and we were able to reestablish pathway activation that was thought to be not available to rehabilitation anymore. So that's why I always tell parents and patients alike that we don't give up on cases. When we see something come in that's been dormant, we like to still give our therapies a try just to see if we can establish new pathway formations. Even in stem cell activity, low-level laser has actually been shown to promote mesenchymal stem cell activation, localization, and proliferation. So there's a lot of variety of uses for this technology, and really the only caveat is that there's a certain sweet spot, or what we call a hormetic dose, that looks kind of like a bell curve, that you want to stay within that range, because we know once laser energy gets into the brain, there's so many things, beautiful things that can happen with that. The caveat being is you don't want to get too high of a dose, which is the biggest misconception, because you hear a lot of people talk, well, if some low-level laser is good, then more must be better, and that can't be further from the truth. The ideal sweet spot for the brain is about 2 to 5 joules per centimeter squared. I know that doesn't necessarily mean anything at this juncture, but it's a low dose response, and you don't want to exceed 13 joules per centimeter squared. So it's for that reason that the only laser that I use in my office is the Erconia low-level laser. It is a low-level set. The red diodes of this laser are 7.5 milliwatts, and the violet is less than 5. It's about 5 milliwatt. And you'll see on here, I'm going to go ahead and just shine this laser real quick so you can kind of see. This one has, actually let me put up a piece of paper. This one has a red and violet diode. And so we're using these red and violets for various physiological reasons. The main research body is behind red, but we're also seeing violet has a lot of research backing it up for germicidal activity, for pathogens, taking out viruses, things of that nature. So that's a handheld. A lot of my parents are buying this handheld. It's called the EVRL laser. It stands for Erconia Violet Red Laser. And a lot of parents, when they see how beneficial these devices are on their kids that we're doing rehabilitation with, will actually purchase one for their own family to use. I'm also right behind me. I'm going to show you. This is my baby. This is the FX405, and this is a big stand laser from Erconia as well. Now, it also has a violet and red component to it, and I'll just show you. Turn this on so you can kind of see it in action. So this one actually has rotating diodes, and it's got the violet and red up here, and then 2 more diodes on each side. And so our patients will have their brains underneath there, they will have their bodies underneath there, and it is definitely my favorite laser for clinic. So those are just a couple of examples of their Erconia product line. They have they also have a red handheld, and they have a red FX635 similar to this. So there's definitely a lot of versatility to these devices. I am a big proponent of all practitioners getting one. I lecture internationally just to educate people on the benefits of these devices. But because it allows, no matter what your training is in neurology, you basically, when you start shining these devices on your brain, you will start to turn on pathways and create all those positive physiological effects that we were talking about. So it just allows for, no matter if you're a pain practitioner, an immunologist, if you're specializing in pathogens, if you're a manual practitioner like a chiropractor or physio or whatever your specialty is, there's rationale to have this in your practice. But most importantly, the benefits that we see with the patients in brain-based rehab. So these tools, I think, should be an integral part of every neurological rehabilitation setting, and especially in the pediatric world where we are seeing pathways open up, we're seeing connections happen. We are seeing pathway formation. When we combine that with functional neuro-brain-based rehab that my colleague, Dr. Bohr, is going to continue to expand on with some of his case studies, you can see just what people would consider miracles happening. So I really welcome the opportunity to come over. We're going to try and get across the pond here sometime in the next few months, and be able to show some of this stuff hands-on. Erconia has the Europe division that we'll be connecting with and discussing this rehabilitation and methods and protocols and all those kind of things. We'll bring that over. I'm looking forward to helping out in any way I can, and again, expanding on this technology and how we use it in our practice. So thank you again for your time this evening, and look forward to seeing and meeting you all in person. And until that happens, here's to good health. And again, if anyone wants to reach out, find out more about this technology, you can email me at azchironeuro@gmail.com. That's azchironeuro@gmail.com, and I'll be happy to answer any questions on that. Thank you for your time.